Benefits podcast with our host, Tom Quigley of ClaimLinx. Tom, how are you? And let's keep rocking and rolling with some of these great topics we can cover regarding helping companies get better benefits and save their bottom dollar. That's not normal. Usually improving and making things better means you're going to pay more. That's usually what society shows us.
That's perception people have, but the reality is you've got to understand what you're buying. And once you understand what you're buying, then it's a matter of getting the best deal with what you're buying.
Totally. All right. So our topic today is from confusion to clarity, how ClaimLinx simplifies health insurance for businesses. And that simplification is what you do. What are some of the biggest misconceptions business have about health insurance costs, and how does ClaimLinx help clear up that confusion?
Everyone thinks that by buying insurance products with co-pays and offices and drug cards, it's the way to go. You buy it from the insurance company and move on. And what they don't realize is the math. It's, hey, why aren't we doing that ourselves? We can give our employees better benefits for less money. It only relying on the insurance carrier for the catastrophic claims.
Yeah. And kind of dive deeper into what you talk about when you're looking at every month and what the costs are involved with deductibles and premiums and where those misconceptions are.
The biggest misconception is that the friendly insurance agent is looking out for your best interests, and they give you a spreadsheet and choose from their spreadsheet. You have no idea what you're buying. Trust us, from them. And all they're doing is traditional things. Whereas there's been tax laws back to 1954 that allow companies to do it totally different. So what the insurance agents have done is weed themselves in the hearts of HR and the office managers of these companies. And the owners have stayed out of it, like laissez-faire, as the French would say, leave business alone. And they have not kept up with the times. The misconception with the benefits is everyone else is doing this, so what's wrong with us doing this thing? The reality is you're having your employees have a $5,000 out of pocket, which equates to $2.41 every hour they work for you. Cost if they use it. On top of that, they're asked to pay premiums. So you're giving $3 to $5 every hour away just for your health insurance that you may never use. And if you do use it, you have to pay it out of pocket because your benefits.
What do you think hurts the consumer more in healthcare? The premium or the deductible?
The deductible, because they don't realize they're going to the hospital. They think, okay, a couple thousand, they end up having to pay 5 or 6. So if they use it, it's definitely, the premiums are pre-taxed. They don't even get through about it. They just go, oh, cost $200 a month. They do it that way. They break it down weekly or bi-weekly paycheck. It's only $25 a paycheck weekly, or $50 a paycheck, whatever it is. They don't even twice about it. I took middle with $53, then they go.
Yeah. And that's just something that you have to say to yourself, really? Is this really what happens? So my next question is, how does ClaimLinx ensure that employees still receive quality health care coverage while employers save money? Because remember I talked about from the start of this podcast is, guess what? How can you get better quality insurance and it costs the business owner less?
It's just benefits. So what they don't understand is benefits, if the owner creates savings, they can lower everyone's out of pocket, their deductibles, their offices, copays, their drug copays, because they have the backdrop of the insurance company covering all the major stuff anyways. So if you say 10,000 a year family, and why not agree to use half of that to improve their benefits? And if they don't use it, you get to keep it all.
And that's the thing. So explain that more so they get to keep it all.
So you're paying 30,000 a year per family as an owner, and now you go down to 10. You have $20,000 of savings. Out of that 20,000, you've been asking the employee to pay 10,000 of it. So then the question becomes, how much do you want to lower the premiums for the families so they don't have to pay 10 anymore? So you make it 5. So you cut what they're paying in half. And then you say, okay, we have $15,000 that we're saving. We've increased the risk for families by $10,000 from where they were. So let's lower the risk. And not only will we cover that care, but we'll lower it further with that extra 5,000. So what we do now is instead of having 5,000, 10,000 out of pocket like you had before, now you have a 2,500 and a 5. So you've lowered their out-of-pocket exposure by using the savings from the insurance company. People just don't understand. They are really taking the players that bad.
They're totally being taken to the cleaners.
Oh, and the kind of the relationship, the office manager or the HR director has, at least all the breakers do, then they become like defense attorneys coming up with like ridiculous scare tactics to scare people out of money that have no relevance. Like that guy in Idaho who finally did try explain how he couldn't have done this or that, those 4 murders. He just gave up because he was dead. But actually, what happens? Sure. The problem is the owners be the ones that initiate it. Is they are not. They're underlings their money. They just view it as, oh, this is a headache because our current agent says we shouldn't do this. Why would your current agent tell you should do this? Do you think it might be that he can look very loose?
Right. Now let's think about the better. So this is a great point, Tom, you're making. Let's talk about the better benefits. Why is it that the employee is not receiving good benefits with the current things that the insurance company is selling?
Because the insurance used to buy those good benefits where they used to have like $500 deductibles or $1,000 deductibles that they called good. Or now, to keep up the inflation every year, they have to increase the out of pocket on the workforce because they kept giving 20% rate increase. So what they did is cut the rate increases year after year down to 5-6%. But the sacrifice was increasing deductible each year from 500 to 1,000, then to 1,500, then to 2,000, and that's why it's out of control.
What tools or resources does ClaimLinx provide to help businesses understand and manage their healthcare plans more effectively?
Everyone gets a schedule of benefits, and if they listen to us, you create a 0 deductible plan, and you make everything a co-pay because it's easy for the employees and the employer to understand. No one understands deductible co-insurance, what the deductible, what goes towards the deductible, what gets not. So what we're doing is we're going insurance companies. All we want from you are 3 things. We want the catastrophic coverage point where you're going to cover 100%. The preventative, because of the Affordable Care Act, already built to the point. And you're giving them a network. So they get discounts prior to them strong. Everything else is a rip-off.
And that's where I don't understand why businesses do this. And why
I
can
really, I don't either.
well, that's why getting the word out. So when I talk about
the HR directors, relationships, the agents, it's the biggest issue, health insurance. I would like to go to these companies, a couple hundred or 50 or even 10, and say, hey, if you could pay nothing for your health insurance and get better benefits, would you be upset that you don't have the same agent? And most would say 98%. I don't know who the hell the agent is. Or that we see them once a year and they're always smiling. Why our deductibles and costs go up?
and that's what makes it so easy to be able to share this story with people. So so I'm interested in also because you constantly are the going guy. Tom Quigley really knows health insurance. He studies it, he looks into it, and he has this brain for numbers. And that's where ClaimLinx comes out as the game changer. How does
My wife understands marriage, buying crazy ideas on advertising, crazy ideas, Mr. Buyer. What she does is she understands creating, manage it. She's the glue that makes it work. Without her, we'd be
exactly? We need to have a limit.
sitting around talking shit at a bar.
You mean to see that's the problem. You, me, and Ed are crazy. We'll come up with these great ideas, but yet we need to implement them, and we need people like your wife and Vanessa to be there to help make it happen.
And then we have my son who's very knowledgeable, and my daughter very happy on It's great as far as bias for longevity. But the staff we have is
Oh yeah, we have to highlight that staff more. That's a great point, Tom. I'm trying to put you over as an expert, which you are. Okay, that's it. You and Ed are these go on your own. No, have something so unreal in ideas, but we got to have people around us.
like, yeah, I haven't paid, I didn't pay any taxes this year in the last, I got all my, it's for the last 3 years back for solar equipment because of the Inflation Reduction. And you can do that up to year 2028, with this big, beautiful bill there. You're saying this right now.
Yeah, we have to find out about that's for another topic, another time, another place. And how do you keep up with your industry trends, by the way? I was bringing that up, and
that against a lot to do with my wife, because my wife was in research trends, sex for Blue Cross in the 90s. And she knows my daughter look out, understand the game, keep us knowledgeable for emails and articles. She's being pretty active. Tell her, just I want to tell the truth. And I read some of the articles from some very smart people. And here's what I've gathered is the government is intervening in health insurance. Hip a lot. Well, care I didn't go back to the US a lot. They put it in section 105. So, they're intervening in health insurance. The problem is they're like down to what? I'll blow your house. Can't blow it down because they don't understand what they're eating and a lot of the stuff. It's so mumble jumble, but our solutions have revenue towards private letter release. Again, we're right. The ones the ones the way these brokers.
exactly.
It's the part.
Yeah, but we're going to find people that say they're like ClaimLinx on the next podcast, so stay tuned. But best place to go is ClaimLinx.com. Schedule a call with Tom today, and we'll talk soon. That was the special simulcast Neil Heavy Show and the Cutting Edge Benefits Podcast, guys. Take care.